Minister of Health Dr. Frank Anthony during his daily COVID-19 update on Tuesday. Independent experts with the Food and Drug Administration (FDA) are expected to assemble on Tuesday to debate whether the Pfizer vaccine shots are safe for use in children between the ages of 5 and 11. The advisory committee will hear evidence from Pfizer and regulators, debate whether to recommend emergency authorization of kid-sized vaccines, then vote on a recommendation. Vaccine authorization will then move to the Centers for Disease Control and Prevention (CDC), where a complementary panel of experts will weigh recommendations on who should receive them. Finally, regulators at both agencies must authorize the vaccines for emergency use in children before they can be distributed. Once this vaccine is given the green light for emergency use, it will pave the way for the rollout of another targeted vaccination campaign locally. It is expected that once the vaccination campaign commences, the nation's children will be further protected. However, while the minister is expecting to administer the COVID-19 vaccines to this age group, there continues to be a marked decrease in the amount of persons between the age of 12 and 17 who are accessing the vaccines. This, the minister said, is attributed to some misconceptions.
Our approach has been that once we go to a school, we open it up to the entire community, so anybody within that age group can come to the school that we're operating in and they can get vaccinated. And we have seen some of that, but in other cases, I think the people felt that only the people who are going to that school can come, and I think that has caused some confusions.
Nonetheless, more needs to be done to encourage parents to get their children vaccinated. As of Tuesday, 26,966 adolescents, or 37% of the adolescent population, received a first dose of the Pfizer shot, whilst 17,489 adolescents, or 24% of the adolescent population, received both shots. More so, 378,533 adults, or 73.8% of the adult population, have received a first dose of a COVID-19 vaccine, whilst 238,902 adults, or 46.6% of the adult population, has received both doses of a COVID-19 vaccine. Meanwhile, can Guyana achieve herd immunity before there is another COVID-19 wave?
We have been working to get to about between 80 to 90%, and even if herd immunity is not achieved, at least we'll substantially reduce the amount of hospitalization and deaths from COVID.
For the HGP 90 News, Kendell Richmond.